Hello, and welcome to Interpreting QPP Feedback Reports. Before we get started here today, we just need to let everybody know that the information contained in this presentation is for general information purposes only and does not attempt to provide medical, mental health, or any other type of healthcare service. This presentation is not intended to be an alternative to medical treatment, and the content of this webinar may not apply directly to specific circumstances. The information is provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep the information up to date and correct, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, or suitability with respect to content. Today's presenters are myself, Alicia Anderson, and I'm joined by my colleagues, Vicki Harden, Tabitha Hanlon, and Claire Weeks. During today's presentation, we're going to walk through how to access your feedback reports, and then we're really going to deep dive into understanding that feedback and how do we turn that feedback into action. We're also going to review the targeted review and kind of how that process works and how do we identify if we want to submit a targeted review. I'm going to pass it over to Vicki to kick us off with accessing our feedback reports.
Thank you so much, Alicia. As you mentioned, one of the key takeaways from our presentation today is to transform the feedback report into actionable insights. We will discuss how to access each category of the feedback report and highlight some actionable items you can use to enhance your performance scores. So to start, let's review how to access the feedback report itself. To view your organization's performance feedback report, of course, you're going to start by visiting the QPP website at qpp.cms.gov. And if you're the security official or if you have an existing user account, you probably are already familiar with this process. But from there, you're going to log in using your HARP credentials or your existing QPP Access account. And depending on that role you have been assigned will determine the access level in reviewing the reports that are available. And also as a reminder, the HARP password expires every 90 days. So if you haven't logged in or logged on in a while, then you will have to reset that password through a verification code. So there is a process of resetting that password. Once you have reset the password, use the new credentials to log in to QPP, to your QPP portal, and then you will proceed to access your feedback reports. So after logging in to your QPP account, you're going to locate that performance feedback on the left sidebar. This will direct you to your View Feedback section of your portal account. So you're just going to click that View Feedback, and you're going to be able to see the performance feedback reports for performance year of 2024. So once you've clicked in the performance feedback, you're going to see all the practices with eligible clinicians associated with your organization's different TINs listed on this page. You're going to select View Practice Details for that desired TIN to access a group or a subgroup or any clinician level performance feedback. Now your organization may have more than one TIN associated, and that's perfectly fine. As for this example, there are two practices. There's two TINs that are associated with this organization. So we're going to view the practice details on the first practice, which is ABC Specialty Clinic. On the right-hand side, you can also download all the data to access score submission, to view your connected clinician list, which is really important, making sure that they are matching what's in your system, and the payment adjustment for each clinician in the practice. So we're going to go ahead and view practice details for the ABC Specialty Clinic. Before moving into the different categories and their feedback reports, let's discuss the final score and payment adjustment. It's important to remember that your final score will determine your payment adjustment. On the left side of your screen, you will see how CMS categorizes this information. You will receive a positive payment adjustment if your score ranges from 75.0 to 100 points. Note that it states subject to a scaling factor due to budget neutrality. For both of these scoring ranges where you receive a positive payment adjustment. Since this is a budget neutral program where those who score lower contribute to the payment adjustments of those who score higher, CMS will analyze where those scores fall, and they will then allocate the available funds for those receiving a positive adjustment, considering the scores of those receiving a negative adjustment. If you receive exactly 75 points, you will neither gain a positive nor a negative adjustment. Rather, you'll continue to receive the Medicare Part B standardized rate. If your score falls below 75 points, the percentage of the negative adjustment you receive will depend on the score within that range. For scores between 18.76 and 74.99 points, you will incur a negative adjustment ranging from 0% to 9%. For instance, so if you score 73 points, you will face a smaller negative adjustment compared to someone who scored 20 points. The amount of your loss depends on where your score falls within that range. Those scoring 18.75 points or below will face the full 9% negative adjustment. So now let's move on to the right side of your screen where you will see a snapshot of the final score and payment adjustment. CMS identifies the reporting framework above your score. And so in this case, in this example, it is traditional MIPS. So on the left side of the snapshot, you will see your final score along with the individual categories scores. Each score represents your performance compared to the total possible score. On the right side of the snapshot, you will find a breakdown of the payment adjustment for the ABC Specialty Clinic. For performance year of 2026, the eligible clinicians will receive a 1.2% payment adjustment for their Medicare Part B services. As I mentioned earlier, once you click on the performance feedback on the left side of your portal account, you will then navigate to the tax ID or the MPI that you are reviewing. Your overall scoring from the previous slide will be at the top, and when you scroll down, you will be able to click into the individual categories and get detailed scoring information on each of those. In this example, all 4 categories were scored, and we are going to view details for each of these categories just to give you a snapshot of what the details looks like and what it means. So now we're going to move into understanding your feedback. My colleagues and I will be breaking down each category as we move through this presentation. And one thing we want to really focus on, and hopefully your key takeaway from this presentation will be those actionable insights that we're going to talk about for each category. First up, I'm going to talk to you about the quality category. So for ABC Specialty Clinic, their quality score was 20.47 out of 30 possible points. And when you click View Details, you will see CMS's calculation for this score. So they received 68.25 possible points from their quality measures that they submitted. You're going to divide this by 100, which is the maximum number of points for the quality category, and you're going to multiply that by 30%, which is the category weight. So ABC Specialty Clinic's total contribution to their final score for quality is 20.47. So as you move through your quality feedback report, you're going to see the list of measures that you submitted for performance year 2024. And some of the areas that you're going to see when you expand on each measure is your numerator and denominator, your data completeness, your performance points, and your final measure score. So for ABC Specialty Clinic, depression remission at 12 months was one of the measures that was submitted. And so if you click the drop down caret on your right, you're going to be able to view the details of that specific measure. It's important to know that each performance measure has its own benchmark, and it's not a universal standard benchmark. And benchmarks are based on that historic national performance data, and it's usually from 2 years prior. This means that a 90% score on one measure might earn 10 points, while the same 90% on another could earn 7 points. And it really depends on how peers perform historically. So for example, you can see if you score 0.48 to 2.07, you will receive 1 decile point for this measure. And if you score greater than 25 benchmark points, then you will receive a full 10 points. You can see here the performance rate is 67.77%. So they did receive a full 10 points for this performance measure. Let's talk about quality improvement scoring, which is a added on bonus to your quality score. And this really rewards clinicians not just for good performance, but also for getting better over time. So you have to have full participation in the program, and then you have to meet that data completeness to be eligible for quality improvement scoring. And you can also receive up to 10 additional percentage points. And this is all based on improvement. If your results show real improvement, like for example, better outcomes or higher measure performance rates, and then you can earn these additional points and they will be added to your quality score. So what they do is they base this on current year's improvement, and they compare it to the previous year's performance. So if there is an improvement, you're going to receive some type of improvement score. For this example, there was a 2.34 increase from the previous year, which calculates into a 0.31% improvement score, which is added to your overall quality score. So quality data provides a snapshot of performance, which is what we just looked at. But without proper analysis, it remains really just numbers on a screen. So transforming the data into actionable insights means connecting analytics really to strategy, right? Identifying those trends, understanding those root causes, and prioritizing interventions that really make a measurable difference. So we're just going to go through just a few insights that could possibly help you when analyzing your data. So first of all, we recommend conducting that gap analysis, identifying those low performing measures, and then identifying any data completeness or reporting issues with those low performing measures. Secondly, validating data accuracy. Ensure that your denominator and your numerator logic are correctly captured. Addressing data mapping errors between systems or vendors. And then make sure you look at those measure specifications, because those do get updated sometimes annually. So you want to make sure the specifications of CMS specifications are aligned with your EMR or vendor specifications. Okay. Identify root causes of those low performances. Examine those workflows and documentation gaps. Engage your staff to understand operational barriers. Get them involved. Implement targeted quality improvement interventions. Develop action plans for those measures. Monitor improvement with monthly or quarterly dashboards. Keeps you on track. Monitor progress and reassess. Revisit the QPP feedback report annually to measure your progress from year to year, and adjust your interventions based on any new benchmarking, which can change annually, or any type of measure change. So as you move through your quality feedback report, you may or may not see information on administrative claim measures. Um, so if you have an eligible clinician who has met the data and patient volume requirements for an administrative claim measure, then you will see that scoring feedback and details. So the administrative claims submission is one of the reporting mechanisms available under QPP. There are 4 population-based measures that you can be scored on. And CMS will utilize these measures regardless of whether the practice opts in choosing these for the reporting method. And these measures are collected through Medicare Part B claims, so there is no submission on your end. They're automatically calculated from your claims. So as you can see on this example, ABC Specialty Clinic was scored on the clinician and clinician group risk standardized hospital admission rates for patient with multiple chronic conditions administrative measure. Okay, so they had a performance rate of 33.19%, which gave them 4.39 points from decile scoring. And you're gonna notice that the details of the administrative claim measures are presented in really the same format as the quality measure details, with the exception of that beneficiary level report, which is available for the measure or measures on which you were scored. And you can really utilize that report in analyzing your data and analyzing maybe some outliers that you can kind of deep dive into more. So, I mean, and a side note, if you're not very familiar with the 4 population-based measures, you can find those specifications, of course, on the QPP website, and you can really read through those specifications and kind of understand where CMS is pulling how they are pulling those and what they are looking for. So administrative claim measures often go unnoticed because they're calculated behind the scenes, right? Using Medicare claims data rather than manually submitting any information. However, analyzing feedback from these measures can reveal, critical insights about care quality, efficiency, and patient outcomes, and helping practices take that informed action to improve future performance. So we're going to discuss some of those actionable insights from administrative claims data. So first, you can identify cost and utilization trends. Those readmissions to the hospital, emergency visits, and the length of stay for those visits. Focus on evidence-based care to avoid those unnecessary services, such as maybe additional labs or imaging. Validate and align coding and billing practices. Conduct regular audits to ensure that codes accurately reflect the delivery of care. Very important. Review the measure case minimum, attribution criteria, and the reporting period, and which I did mention that information can be found on the QPP website when you review the specification for the measure. Target those high impact measures. Use measures to align improvement projects with organization quality measures, those PDSAs, very important. Strengthen care coordination and follow-up. Use information to improve your referral tracking, closing those loops, transitions of care, and external provider communication. Use automated systems to send reminders for appointments, medication refills, or follow-up calls. There's all kinds of things, all kinds of processes you can put in place to strengthen that care coordination and follow-up. So now I am going to hand it off to Tabitha to talk about the Promoting Interoperability Feedback Report.
Thank you, Vicki. Next, we'll move into the promoting interoperability category, where you use your technology and data exchange capabilities to make up 25% of your overall MIPS score. To begin, let's take a look at how promoting interoperability is scored within your MIPS performance feedback. As you can see on the left, promoting interoperability accounts for 25% of your total MIPS score. When you open your feedback report, you're going to see your PI score summarized here, and then you can click View Details to explore the full calculation. On the right-hand side of your screen, we can see how that total is derived. CMS calculates your category score based on your base performance, and then any additional bonus points earned for activities such as public health reporting. In this example, the provider achieved a base score of 98 points. They received 5 bonus points for a total of 100 points in the category. The total is then multiplied by the 25% category weight, and that resulted in a 25 out of 25 possible points toward the overall MIPS score. So PI can make a significant impact on your performance and your final score, and maximizing participation in all the required measures helps you ensure that you receive full credit for that category. So once you've reviewed your overall promoting interoperability score, the next step is to look more closely at the individual objectives and measures that make up the category. In the feedback report, you'll see each measure listed along with its score and performance details. Some measures like prescribing or query of prescription drug monitoring program are numerator denominator based. These display the total number of qualifying actions, or your numerator, and divide by the total number of opportunities, which is your denominator. The resulting percentage determines your measure score. Other measures, such as security risk analysis or completion of SAFER guides, are attestation based. These are simply reported as a yes/no response. A yes indicates that the activity was completed during the performance period, and that's what earns you credit for those measures. The main point here is that not all PI measures are scored in the same way. So it's important to understand which ones are yes/no attestations and which one are numerator-denominator calculations, so you can target improvement efforts appropriately. So to finish up the PI category, we'll walk through how to use your PI data to drive change and improvement. Each objective in this category provides an opportunity not only to meet compliance requirements, but also to strengthen your organization's readiness, documentation, and overall performance. We'll begin with attestation statements. These statements form a strong foundation for promoting interoperability reporting. It's important to have clear, concise policies in place for areas such as security risk analysis, IT safety, HIPAA, and information blocking. Each policy should include documented follow-up on findings to ensure continuous improvement. One thing that can help is assigning a PI champion. This can be incredibly valuable in these cases. This person can help coordinate quarterly readiness reviews and help maintain a consistent focus on compliance throughout the year. Finally, maintain an annual audit binder with all the supporting documentation for each attestation. This helps demonstrate a culture of preparedness and transparency if or when you are chosen for an audit. Next, we'll move to e-prescribing. It's essential that all scheduled medications, specifically Schedules 2 through 4, are generated electronically. This not only supports compliance, but also improves safety and prescribing efficiency. Equally important is ensuring that all CASPR queries are being integrated directly into the patient's record. This will, of course, depend on your EHR's capabilities. Some have the capability to run a CASPR report and integrate it into the patient's record already built in. For others, this isn't an option, and they must run the CASPR report manually and then scan the report into their EHR. Whichever way you use, make sure that all the staff understand and are following the approved workflow. We also recommend monitoring your e-prescribing and CASPR utilization reports regularly. These reports can help identify workflow gaps and provide provider-level variations that can be very helpful. Now, for provider-to-patient access, this objective focuses on empowering patients to easily access their own health information. We recommend to start by confirming that your patient portal is fully functional and connected to your EHR. Then take time to review your portal workflows with all your staff and develop clear scripting for your frontline team. Consistency in your communication helps patients feel comfortable using your portal and can help build trust in your system. Lastly, don't forget to track your portal activation and usage rates by patient population. Monitoring this data can help identify any equity gaps and guides outreach efforts to increase engagement. Now, moving on to health information exchange. This is a critical component of interoperability, ensuring patient information moves securely between systems. So option 1, which is the sending and receiving option, we recommend here that you review your numerator and denominator reports and work proactively to close any data gaps that you find. Option 2, or your bidirectional exchange, you would need to verify that your organization is connected with a third-party HIE and that the integration with your EHR is functioning as expected. And the last option, 3, is your TEFCA option. So this is where you're going to consider connecting with a national quality health information network that operates under TEFCA. This strengthens long-term interoperability and positions your organization for future requirements. And we kind of recommend the same thing with the bidirectional, just making sure that all of your agreements are signed, everything is integrated with your EHR, and it's functioning as expected. And last, with public health reporting, ensure that your connectivity and participation agreements with the public health agencies are in place and up to date. That's super important with this category. Keep your documentation of any onboarding efforts and save all your confirmation emails. This will be very valuable if you're ever audited. If your practice doesn't provide any immunizations or treat any reportable diseases, it's important to claim the appropriate exclusion in your attestation. Leaving that field blank can create an unnecessary compliance risk and can affect your scoring. So in closing, promoting interoperability is more about running your data and working with your teams than checking boxes. You're going to use your data and your documentation to drive continuous improvement. By breaking each objective into practical, measurable steps, your organization can maintain compliance and also advance toward greater efficiency, connectivity, and patient engagement. Now I'm going to pass it over to Claire, and she is going to cover the improvement activities category.
Thank you, Tab. Now we're going to take a closer look at improvement activities. Next, let's take a look at how improvement activities is scored in the QPP feedback report. On the left-hand side, you'll see the summary view from the feedback report, and this section shows your total score for improvement activities. So in this specific example, the clinician earned the full 15 points out of 15. If you click on View Details, you'll be taken to a further breakdown that you can see on the right-hand side of the screen. The scoring for this category is based on the number and type of activities you attest to. Each activity is weighted as either medium or high, and here the clinician reported on high-weighted activities totaling 80 points. Since the maximum number of points possible in this category is 40, the score is capped at that value. That 40 out of 40 then gets multiplied by the category weight, which is 15% of your overall final MIPS score. As a result, this clinician receives the full 15 points in the improvement activities category. This example just shows that completing and attesting to enough improvement activities to reach that 40-point maximum ensures that you receive full credit in this performance category. Now that we've covered how improvement activities are scored, let's take a closer look at the feedback details provided in your report. On this slide, we're looking at the expanded performance details section. This is where you can review a summary of submitted activities, your total activity score, and any special considerations you may have had, such as participation in a certified patient-centered medical home or being part of a small or rural practice. On the right-hand side, you'll see an example of how your submitted activities are displayed in the report. Each activity is listed by its measure name, the weight assigned to it, either medium or high, and the corresponding activity score earned. For instance, under beneficiary engagement, the clinician attested to a high-weighted activity worth 20 points. Under patient safety and practice assessment, there are 2 medium-weighted activities, each worth 10 points. Reviewing this section helps you confirm that the activities you reported were properly captured and scored. It's also a good opportunity to verify that all activities align with what was actually performed and documented during that performance year. Once you've reviewed your improvement activities feedback, the next step is to think about the upcoming performance year and how to use the information that you've received on the previous performance year to drive meaningful change for what's coming up. This slide highlights key steps to help transform improvement activities into some actionable insights that can help improve any scores that need improving and also make an impact on your organization. First, it's most important to choose improvement activities that naturally align with your organization's existing goals and priorities. When your improvement activities support the work that you're already doing, they become easier to sustain and more meaningful for your team. So you can choose improvement activities that naturally align with any quality initiatives that are going on, patient experience projects, or care coordination goals. This ensures that initiatives drive measurable impact. It can also help promote staff engagement and maximize your resources that you have already. Next, it's important to maintain clear documentation of implementation. This means keeping detailed records of what has been done, when, and by whom. And having this documentation not only supports your attestation, but also helps ensure consistency if staff or processes change. So maintain clear documentation can mean meeting minutes or attendance logs, any training materials that have been developed and used, reports or dashboards on any improvement activities, and including workflows and processes can also help maintain that clear documentation of implementation. Finally, it's important to review the validation criteria for each activity. CMS provides specific expectations for what qualifies as completion. Reviewing those criteria up front helps you verify that your documentation meets requirements and prevents surprises in case of an audit. On the right, you'll see the goal of this process illustrated. Aligning those organizational priorities and improvement activities create that meaningful, sustainable impact. When these areas overlap, that's where that true improvement happens, both in quality and in care.
Thank you, Claire. Next, let's move into the cost category. Unlike the other categories, cost requires no data submission. It's claims-based, automatically calculated by CMS, and accounts for 30% of your total MIP score. First, we're going to take a look at how cost is scored within the MIPS performance feedback. The cost category accounts for 30% of your total MIPS score, as long as you're attributed to at least one cost measure. In this example, the clinician received 21.71 out of a possible 30 points for cost. When we click View Details, the report provides a breakdown of how that total is calculated. Here you'll see the provider's total awarded cost points, in this case 194.58 out of 270 possible points. That score is then combined with any applicable improvement score and multiplied by the 30% weight to determine the final contribution to the overall MIP score. The improvement score reflects how much the provider's cost performance improved compared to the previous year. For this clinician, their cost score increased from 54.66, to 72.06, resulting in a 31% or 0.31% improvement bonus. At the bottom of the report, you may see a section labeled Special Circumstances. This confirms when an improvement score or other adjustment has been applied. In this case, that same 0.31% increase. The main takeaway here is that cost scoring is entirely claims-based, requiring no additional submission, and includes both performance and improvement components. Monitoring your attributed measures and comparing year-over-year trends is key to understanding how your cost score is determined. So now that we've looked at how the cost category is scored overall, let's take a look at what you'll find when you drill down into those cost feedback details. At the top of this section, you'll see your total cost category score. In this example, 21.71 out of 30 possible points. Below that, CMS is going to list the specific cost measures that you were scored on. In this case, the clinician received scores for both Medicare spending per beneficiary clinician and total per capita cost. Each measure will display your average cost per episode or per beneficiary, along with the measure score that contributes to your overall cost category score. To see additional details for any measure, you can click the small caret icon on the right-hand side. And this is going to expand out the section to show you the underlying data. And you're going to see things like the number of attributed episodes, observed versus expected cost, and the national benchmark comparisons. CMS also releases patient-level cost measure reports around August when the final performance feedback becomes available. Those reports provide the most detailed insight to which patients and episodes contributed to your cost performance. And this can be really helpful in identifying opportunities for improvement. So make sure that you're not only reviewing your cost score, but that you're also digging down into those measure level details and supporting reports to fully understand your performance. So in the previous slide, I spoke about viewing the detailed breakdown of your measure level data. Let's use Medicare spending per beneficiary clinician as an example. As you can see, we've clicked on that caret on the right-hand side of the measure. The section labeled Measure Details includes key data points, things like your number of eligible episodes, your average and adjusted per episode cost, and your observed to expected ratio. This is also called an OE ratio. That ratio compares your performance to the national average, with a value of 1.0 meaning your costs are right in line with the expected amount. Values above or below 1 are indications that your spending was more or less than expected. Below that, you're going to see your performance points. This is where the decile scoring is going to come into play. CMS groups all providers nationally into deciles, from 1 to 10, based on your performance. The green bar at the bottom is going to show where you fell within those deciles. In this example, the clinician's average cost of $24,264 per episode placed them in decile 7, earning 7.58 points for this measure. One important note is to even be scored on a cost measure, you have to meet CMS's minimum case threshold for that measure. So if the required number of attributed episodes isn't met, the measure won't be scored at all. And finally, you'll see the link labeled Download Beneficiary Level Data. This is where you can access your detailed patient level reports, and those are going to list every attributed case. It's going to include your cost components, diagnosis-related groups, and discharge information. These reports are excellent resources for drilling down into specific drivers of your cost and identifying areas for improvement. So here is one more example. This time we're going to look at total per capita cost. So just like the previous example, you can expand the measure details and view your average per capita cost. You can view your number of attributed beneficiaries and your decile-based performance score. In this case, the clinician had an average cost of $1,694 per beneficiary. That placed them in decile 6, and they earned 6.87 points for the measure. You're also going to see a link here to download the beneficiary level data just like before, and that's going to provide a list of attributed patients and associated cost details. This report can be extremely valuable, just like I said before. It's going to help you identify your most complex patients, high utilizers of care, and it's going to help you target areas where interventions may reduce unnecessary spending. And that's the goal overall. Finally, it's important to know what happens if no cost measures are scored. So if you don't meet the case minimums for any cost measures, or if CMS couldn't establish a benchmark for the cost measures that you did qualify for, the cost category overall is going to be reweighted to 0, and your 0% of your final score, I should say. In that case, the 30 points normally assigned to cost are going to be redistributed to other categories. 25 points is going to go to quality, and 5 points is going to go to promoting interoperability. So you're still going to have a possible score of 100 overall, but it's just going to redistribute those points to those other categories. Now let's take a look at how we can take cost data and turn it into something we can use to truly drive value-based care. The goal is going to be to move beyond simply reviewing those cost reports and instead use that information to understand the why behind spending patterns and uncover opportunities for improvement. So first, we're going to begin with the cost feedback report, which we've talked about a few times in this section. So reviewing your previous year's performance and those beneficiary level cost data reports can reveal a wealth of information. It can reveal patterns of variation, high cost conditions, and lots of opportunities to improve efficiency. Next, we're going to recommend that you conduct HCC coding reviews regularly. And this can ensure that you have risk adjustments that accurately reflect your patient's complexity. This is key to fair cost comparisons, and it's going to help your clinicians to understand how documentation impacts performance. And finally, share cost trend data with your care teams. We want everyone to understand those modifiable drivers of spending. And these are the areas where small process changes can lead to big impacts for your organization. So next, let's move down to identifying patients with multiple chronic conditions. So enrolling patients into targeted case management programs or chronic care management programs can really help provide proactive support for your patients. It can help them better manage their conditions and reduce avoidable hospitalizations and just provide better support overall for your patients. Next, make use of your EHR's risk stratification tools. These are going to help you identify high cost or high risk patients early. This can allow your care teams to focus their resources where they'll have the greatest impact. Next, let's move down to care coordination and transitions of care. These are critical factors in both quality and cost outcomes. So we recommend that you implement post-discharge follow-up calls. It's best if these are done within 48 hours of discharge to ensure that patients understand their care plans and that they have the support that they need to. This can help to avoid readmissions into the hospital and lower your cost. Next, use your HIE connections to notify your providers when patients are admitted or discharged from the hospital. And this can help to relieve that handoff between those care settings and make it more seamless. And last, make sure that you're tracking those readmission and emergency department visit rates and where your transitions of care and workflows are functioning. Next in line is optimizing coding and documentation. So education for providers annually on the importance of capturing comorbidities and chronic conditions accurately can be super helpful. So when their documentation reflects true patient complexity, both care management and performance scoring can improve. It's best to regularly audit your problem list within your EHR to ensure that your diagnoses are current. That they're super specific. This is very important for your risk scoring, and that they're coded appropriately because precise documentation not only supports compliance, but it also paints a better picture of your patient population and that complexity that's within it. And last, definitely but not least, we come to educating clinicians on attribution and accountability. It is so important to help clinicians understand how cost attribution works and what drives those metrics, how ordering and referral patterns can affect their scores. So provide clarity around what CMS uses and how those calculations are made. We also recommend that you encourage peer comparison discussions. That can also be a powerful motivator. When clinicians see their data in context, it often sparks engagement and collaboration around improvement efforts. So that can be super helpful as well. So in closing, and just to recap, cost is entirely claims-based and driven by attribution and benchmarks. Review those beneficiary level data reports. Can definitely help you understand what drives those costs and prepare for future performance years. Transforming your data into actionable insights, it's going to require both analysis and education. And it's going to require that on a regular basis, not just at one time during the year. It's going to be an ongoing process. So by identifying cost drivers, improving coordination, and building awareness around your attribution, your organization can make data-driven decisions, and that can support both financial sustainability and high-quality care. So now we're going to pass it over to Alicia, and she's going to cover the complex patient bonus and other items.
Thank you, Tabitha. Now we'll dig a little bit into the complex patient bonus and other items. So when you're in the QPP portal and reviewing your feedback, you can find the complex patient bonus scoring directly under the performance category scoring information. But to really understand what the complex patient bonus is, let's take a little bit of a closer look at how it is calculated. So there's really going to be two key components that CMS uses, and that's going to be medical complexity and your social risk. So that first piece is the medical complexity, which is going to be measured using your HCC risk scoring. And just as a refresher, the score is going to reflect the overall health and complexity of your patient population. It's calculated using a number of factors, including your patient's age, gender, diagnoses from the previous year, whether they're dually eligible for Medicare and Medicaid, if they qualify for Medicare due to disability, or if they live in an institution like a skilled nursing facility. All of these elements are really going to come together and feed into your HCC score, which is ultimately going to give CMS a picture of how medically complex your population is. A higher score here means that you're caring for more complex patients. So in the example that we see on this slide, the average HCC risk score was 2.5949, which is going to be well above the national median of 1.29 from the prior year. So this score is definitely going to qualify for the bonus under that medical complexity piece. And then the next piece is social risk. And this is measured by the percentage of your Medicare patients who are dually eligible for both Medicare and Medicaid. So CMS is going to look at your dual eligibility ratio for the performance year and compare it to the national median from the previous year. Because dual eligibility is linked to socioeconomical factors and higher social needs, CMS includes it to recognize providers who really are caring for those more vulnerable populations. So in this case, we can see the ratio was 0.2641, which is just slightly over that median threshold of 0.2. So in this example, this score does qualify as well, though it is much tighter than our medical complexity score. So in this scenario, because both the medical complexity and social risk components meet or exceed that threshold, both are going to factor into the complex patient bonus score. So this is going to mean additional points and potentially a better final score for serving a more complex, higher risk population. So now that we've looked at how the complex patient bonus is calculated, let's shift gears and talk about what you can do to improve your chance of qualifying for the complex patient bonus or even increasing your score and what that bonus might look like for you. So first, let's start with optimizing your HCC risk coding. So this is going to be really foundational. You're going to want to work with your providers, your coding staff, and your CDI teams to really ensure those diagnoses are being captured accurately into that highest level of specificity. The more detailed and complete your documentation, the better your HCC scores are going to reflect that true complexity of your patient population. And then you can also leverage clinical decision support tools to make the most of your EHR system to really help you flag gaps and opportunities for better documentation. Next, you're going to want to focus on ensuring complete and accurate demographic and insurance data. So this means having strong policies and procedures in place and making sure your team is capturing correct insurance information, especially when we're looking at dual eligibility. And then performing regular audits of demographic data. Even small data issues like outdated addresses or insurance information can really impact your eligibility metrics. The third area I want to talk about today is using and optimizing technology. So really using your systems to stratify your patients by risk. So particularly those with multiple chronic conditions or those who are dually eligible. Once you've identified these complex patients, you can use care coordination tools and integration strategies to make sure their needs are being addressed proactively. This is not only going to help improve your outcomes, but support the kind of documentation that CMS is looking for in bonus calculations. And finally, don't overlook the value of your attestation feedback. Really, you can use it to identify gaps in performance, and then engage both your clinicians and coders in conversations, not just to review the data, but to plan how to improve it. Set measurable goals and track your progress regularly. And that ongoing focus on improvement is really going to have a real and meaningful impact on your final MIPS score. So this slide here is really just an FYI. It's an additional item in your performance feedback you can view, and it's titled Items and Services. And this is going to house data attributed to your Medicare beneficiaries across different services that you provide. And these are going to be determined by your HCPCS codes. So this is to be used for informational purposes and really gives you a look at the services received by your Medicare patients throughout the calendar year. And this is going to look different for everyone depending on the services that you provide. But in this example, we can see things like anesthesia services, digestive system, and radiology services. And then if you scroll down a little further, it's going to get into your ED department utilization and so on. So this isn't going to be factored into your MIPS performance score, but it is a great way for you to kind of gauge what services are most utilized by your patients. So to bring everything together, let's talk about how you can strategize for success across all parts of the quality payment program. So a great place to start is by partnering with your advisor. We are here to help you walk through your feedback reports and review that detailed insight into how you performed for the performance year. These reports are really full of actionable information, including where you're doing well and then where there may be gaps that we can work together to address. And then we can also help review the measure specifications, attribution methods, and the coding that's going to trigger each measure. And that's going to be really important for ensuring that all of your efforts are being fully captured and counted in your scoring. A lot of times the work is happening, it's just not being documented or coded in a way that aligns with those CMS requirements. And then again, we can't overlook the importance of your HCC scores. So it's not just for the complex patient bonus, but for really understanding the overall complexity of your patient population. Those higher HCC scores are going to reflect that higher clinical risk, and it's going to influence your performance scores and the complex patient bonus, as well as cost in your quality measures. And then just always remember, you don't have to do this alone. You have resources, both internal and external, and you should be leveraging all the resources that you do have available. Some of those resources might be KHI and Connect. They're going to help offer tools and data exchanges that can really support everything from patient tracking to eligibility. And then we have our community-based organizations, or our CBOs, which Connect can also help us connect to. And these CBOs can really help us address the social determinants of health, which are going to influence not only patient outcomes, but can really help support improvement across different categories. And then you have your referral partners. They are very critical in closing care gaps and helping to improve that care coordination, which is going to impact both your quality and cost. And then you have your internal, depending on each practice might have a little bit of a different setup, but looking at things like your internal care management and population health teams. A lot of times these departments are already doing a lot of work that can support MIPS, really including that chronic care management, transition of care, and patient engagement activities. So really the key takeaway here is you're not starting from scratch. By collaborating with your advisor and pulling the right tools, partners, and data, you can make meaningful improvements across all the QPP categories and really position your practice for better scores, better care, and better outcomes moving forward.
Thank you, Alicia. Now we're going to talk about the targeted review process. The targeted review process is a formal, limited process that allows clinicians, groups, or APM entities to request that CMS review the calculation of their MIPS score and payment adjustment if you believe an error has occurred. As you can see, the current activity period for performance year 2024 is now open, and you can submit your request by clicking the Add New Targeted Review button in the QPP portal until November 14th, 2025. The request can be submitted by clinicians or group taxpayer identification numbers who believe that there is an issue with their MIPS score calculation. Reasons for a targeted review must be based on a calculation or data attribution error, not simply a disagreement with the MIPS policy or scoring methodology. On the left-hand side, we've broken down some valid reasons to request a targeted review, and I'll go over those briefly. So some examples of reasons to request a targeted review could be a denominator reduction. So this is for situations where you successfully submitted all available quality data, but the denominator count used in the calculation was incorrect. An incorrect TIN or NPI. Special status designation. So if you had a special status, such as being a small practice, but it wasn't correctly reflected in your performance category score. An incorrectly scored result with an approved hardship exception. So if you were approved for a hardship exception, but were still scored in that category. QP designation or missing final score. And on the bottom, we've also listed a few examples of invalid reasons to request a review, such as general disagreement with a low payment adjustment or a misunderstanding of the scoring policy. These are not subject to targeted review. The green box highlights a very important reason qualifying for reweighting due to uncontrollable circumstance. If you believe a performance category should have been reweighted because of an extreme or uncontrollable circumstance, like a natural disaster or public health emergency, you must submit documentation supporting your request. Finally, please pay close attention to the time-limited section in red. Your request must be submitted by November 14th, 2025. You can submit this request directly on the QPP website through your feedback report. Overall, it's critical that you act quickly, review your performance feedback, and submit your request with all necessary documentation well before the deadline. Targeted review decisions are final and cannot be appealed further. If you've determined a valid reason for a targeted review, the next step is to navigate to the QPP website and submit a targeted review application. This slide shows some key parts of the online application process. Once you've filled out some basic information, such as your role and your TIN, you'll see the left-hand side of this slide pop up, which asks you to identify which performance categories were affected by your issue. You have the ability to check boxes for all categories that your issue pertains to. So for example, if you believe that you were scored incorrectly on a MIPS measure, you would simply just check quality and leave all of the other ones unchecked. If you think that your promoting interoperability hardship exception was not correctly applied, in that instance, you would check both promoting interoperability and additional awarded bonus points, as both of those categories have components that can affect your final score calculation. The most crucial part of any targeted review request is the supporting documentation. As you see on the right, the application provides a simple drag and drop area for uploading your files. CMS requires documentation to validate your claim of any error. To help you prepare, we've highlighted some of the key reports and records that you can gather. These include any feedback reports, screenshots of practice details, submission confirmations, measure specifications, and performance reports. This system will accept standard files such as PDF and images, so you can upload multiple files to support your claim. Once you've selected the affected categories, provided a detailed explanation, and uploaded all of your supporting documents, you'll certify and submit the request. We've outlined some key steps to determine if a targeted review is right for you. The flowchart illustrates what you should be doing to make the most of any targeted review opportunity in your feedback report data. The most important takeaway is the tight timeline. Every year, a hard deadline is set by CMS, so it's important to move quickly. The first key action is to review scoring by category. You should look at your MIPS final score and then drill down into each individual category: quality, improvement activities, promoting interoperability, and cost, to check for the specific errors we just discussed. The steps on the diagram highlight key areas where calculation errors often occur. It's important to review measure scores and quality to identify improvement areas. In the yellow box, you'll see that while you're primarily checking for calculation errors, this is also a chance to compare your performance to the benchmarks and peer averages to inform your strategy for the upcoming performance year. Compare your PI measure scores with current progress. For the promoting interoperability category, check that all your required measures were correctly calculated for your 180-day performance period. Review improvement activity for special status appropriateness. Confirm that your documentation and the attestation of your improvement activities match your practice's special status or reporting requirements. The final step in this immediate process is to review your cost measures and submit targeted reviews early. The cost category is calculated solely by CMS, so be sure to review the data closely for patient or episode misattribution. Because the entire window is so short, we strongly recommend you submit your targeted review as soon as possible with all supporting documentation well before the deadline. Once you submit, CMS will review the request and documentation and issue a final determination, which will result in either an updated MIPS final score and payment adjustment or a denial. By following these steps, you are protecting your current payment adjustment and ensuring your practice's performance data is accurate for future Medicare payments. I'm going to kick it back to Alicia, who will close us out.
We want to thank everybody for your time and attention. If you have any questions about today's webinar, please send us an email at kyrec@uky.edu and we will get an answer for you. You can also reach out to us for questions about today's webinar or questions about our services by phone, email, or you can check out KentuckyREC.com. We're also on Facebook, LinkedIn, and X. Thank you.